Welcome to Building Healthy Connections, a space for healthcare professionals to understand how culture impacts healthcare. And now your host, Berthine Crèvecoeur West.
Welcome to our very first episode of Building Healthy Connections. This is a space we've created in order to discuss culture, diversity, and the field of medical interpreting. I'm your host, Berthine Crèvecoeur West, and today we're going to be talking about the PreSession. So what's a PreSession, you might ask? Well, think about it this way. When you go to see your doctor, your medical provider, you don't need to have a PreSession because you speak English. But what if you're an LEP? What's an LEP? An LEP is a limited English proficiency person. That means the person doesn't speak English as their first language. Now, that's not to say they don't speak English at all. On the contrary, they just have limited English. So they need medical interpreters, and that's where the PreSession comes in. The PreSession is an introduction that the medical interpreter provides the LEP and the provider. This is done in both English and the target language. The target language is the language that we'll be speaking when we're serving as a medical interpreter. So let's discuss the other parts of the PreSession. There are 6 parts, and we'll go through them one by one. The first part is to introduce yourself and say your name. So I would say, hello, my name is Berthine. And then I would shake hands with the provider. If the LEP is there with me as well, I would then introduce myself to the LEP in the target language. I happen to speak Haitian Creole, so I would say, bonjour, moi le Berthine. Then the next part is, everything will be kept confidential. Now, this is a really key important thing to say because LEPs and providers need to know that you're not going to leave and discuss their information with anybody else. This is an important thing to know because LEPs and providers need to understand that you're not going to leave and discuss their personal information with everybody else. Also, being that you're a medical interpreter, you are subject to HIPAA as well as the provider. And that HIPAA, for those of you who don't know, is the Health Insurance Portability and Accountability Act. That is a regulation that states that we cannot discuss anybody's personal medical information. We cannot identify them through their medical information in any way. So medical interpreters are beholden to HIPAA just as the providers are. So once you've let them know that everything will be kept confidential, you move on to the second part, which is everything that is said will be interpreted. Now, this is also very important because it lets the medical provider know that whatever they say, if it's an if it's an and, if it's anything that might come out of their mouth, it will be interpreted by you, the medical interpreter. This is a part of your code of ethics. Also, again, you would say this to the LEP, so they know this as well. Oftentimes during the medical encounter, which is in layman's terms the medical appointment, people may say things that may be said under their breath, that might not seem like a big deal, that might be a side conversation with you, the interpreter, but we need to interpret it as medical interpreters. The next part is, I will be interpreting in the first person. Now that means I'm going to say what you're going to say. So if you say, I am tired, I will say, I'm tired. If you say, I'm hungry, I will say, I'm hungry. It's important for you to let the medical provider know that you're doing this so they're not thinking that you're speaking. It's also important for you to let the LEP know you're doing this so they understand that it's also the provider's voice that you're using. And with regard to the LEP, it's always good to provide them with an example. Most people don't understand what first person is. That's why you have to say, I'm going to speak as if you're speaking. This is usually a great layperson example to use. The next is pause often so I may interpret accurately. It's really important to say this as opposed to saying use short sentences so I can catch up, because you want people to understand that you are capable, you're qualified, and you can do this. But you do need them to pause often. Interpreters are not expected to regurgitate 10 minutes worth of spoken information. That is not an accurate way to provide good quality service, if you will. So make sure you encourage the provider to speak at a normal pace, but also to use layperson language if necessary. Sometimes their register may be very high, and to pause as often as possible, as often as you need them, without being too disruptive. Pausing too often is a sign that the interpreter is not able to keep up with the pace, and a professionally trained medical interpreter should be able to do so and compile about 6 to 7 sentences and be able to render that interpretation. Any pauses that are more frequent than that would be considered obtrusive, and it would take away from the effectiveness of the communication between the LEP and the provider. Next, you want them to speak directly to one another. This is really important because oftentimes people focus on the interpreter, and that is not why the interpreter is there. The interpreter is there as a bridge to help the medical provider and the LEP establish a rapport, a relationship between one another. And this relationship is very, very important because you may not be their interpreter the next time. They may have a different interpreter, but that is still their doctor. That is still their clinician. That is still their patient. That is still their appointment that they have to see. So the two of these individuals have to have a relationship that you help build and foster and create, but that is not based upon just you. So if there are 10 other interpreters that do their job the way that they should, as all professionally trained medical interpreters are beholden to do through following the code of ethics, you will be literally the voice. And so the next person that comes to replace you will also be the voice. So in that sense, you will be speaking for both of them, but the relationship that they will have will be between one another. Just as I go to see Dr. Smith, and Dr. Smith knows Berthine her appointment is at 5 p.m. So this is the same type of relationship that we want the providers and the LEPs to have. And the last part is, I will raise my hand if I need you to pause. Now, clearly you can't see my hand, but all you need to do is simply raise your hand, not too high, not too low, just towards right near your chest, and let the provider know. It doesn't have to be a big obtrusive sign. It just has to be kind of a visual cue to let them know that you need them to stop for a moment. The same thing can be said of the LEP. Now, I should also point out that when you're giving this pre-session, it's best to go through all of these 6 steps first in English to the provider, and next in the target language to the LEP. So that will be Spanish, French, Haitian Creole, Arabic, Korean, what have you, Somali, Tigrinya, Amharic, any language that you'll be serving. First, you would say it in English to the provider, then you would say it in the target language to the LEP. So essentially, what it would sound like once you've compiled all of these things together is, hello, my name is Berthine. I'll be serving as your medical interpreter today. I'll be speaking in Haitian Creole. Everything I say will be kept confidential. Everything that is said will be interpreted. I'll be interpreting in the first person. Pause often so I may interpret accurately. Speak directly to one another. I will raise my hand if I need you to pause, like this. Now, for the LEP, I would probably lower the register, meaning the difficulty of the language, slightly. So for the LEP, my pre-session would look something like this. Hello, my name is Berthine. I'll be working as your interpreter today. Everything that I say will be private. Everything that you say, I will say. I'll be speaking as if you're speaking. Please keep the sentences somewhat short so I can give them the right information. Please feel free to speak directly to your doctor. I will raise my hand like this if I need you to pause. Do you understand everything I've just said? And there are as you can see, there are slight differences in the pre-session, but the general idea remains the same. I'm conveying the same message, but the register is different. So my terminology is probably more complex and more formal with the provider, but it's slightly more kitchen table talk, lay people talk, everyday talk with the LEP. Now, this is in no way to suggest that the LEP population is uneducated or less educated than anybody else. We would use this same layperson pre-session for the diplomat, the farmer, the senator, the hostess at a restaurant. This is to ensure that everyone fully understands exactly what is being said. And with regard to medical interpretation, you have to make sure that people understand what is happening to them. And without the PreSession, you'll notice perhaps if you ever go to a hospital and you see an interpreter not using a PreSession, that's the first sign that that interpreter has not been trained. Now, when this happens, chaos always ensues because then no one knows what the interpreter's role actually is. So if I were to not do this PreSession, no one would know my name, no one would know how I'd be interpreting, no one would know what I'd be interpreting. Maybe I would say some things and leave other things out. No one would know who to look at. So of course they'd all look at me because I'm the one doing the speaking. And then they would not build a relationship. They would depend too heavily upon the interpreter to have just basic communication with one another. So that would mean the next time they had an appointment together, they wouldn't think about each other. They would be waiting for the interpreter to carry the appointment through. And that's not a good thing, because what if they had a different interpreter? And so they wouldn't know why I'm raising my hand if I raise my hand at all. So a PreSession, although it's just 6 simple parts, it's really, really important for people to understand. Now, I should also maybe take a step back and talk to you about how you would greet someone when you're doing a PreSession. And this is where culture comes in, and this is the exciting part about culture. In our particular cultures, we may greet people differently. Being that my family is of Haitian descent, we tend to greet people by kissing them on the cheek. And the longer you've not seen the person, the more kisses on the cheek you give them. So if I wake up in the morning and I see one of my parents, I'll kiss them once on the cheek. If I see a friend, I'll kiss them twice on the cheek. If I see a relative that I've not seen in many years, I'll kiss them perhaps 4 times on the cheek. So this is something that is customary for my culture, but not necessarily for the cultures I'll be serving. So with regard to that, let's take France, for example. In France, people do kiss each other hello, but also the handshake is very common. So one has to remember that being here in the United States, it's always best to go with what is traditional in this particular culture, which is to shake hands. However, the population that you'll be serving additionally is the LEP population, so they might be from any country. If we're using French as an example, French is spoken in many different parts of the world. Let's use Spanish also as an example, spoken in many different parts of the world, but that is not to say that each and every Spanish-speaking country, each and every French-speaking country is the same with regard to culture. The way you might greet an Argentine may not be the way you might greet a Mexican. There might be differences, there may not be. That is beholden, the onus is on the interpreter to not only understand something as simplistic as a greeting, but understand that each and every culture that they serve may have a different greeting, even with regard to the spatial configuration. How closely can I stand to someone? If I'm interpreting for someone from Senegal, I have to take into consideration how I greet them with regard to my gender, with regard to the amount of space that is between us. What we call in the United States here personal space. How closely will someone stand next to me? If you're from France, you can stand very close to someone and it's fine. If you're from, let's say, the United States, you like to keep basically kind of half an arm's length because that's considered respectful. So ATM distance, that is a great example to use because you're not going to stand right behind someone or right in front of them. You're going to give them a little bit of space. So these are the small nuances that really determine how you're perceived by the LEP that you're serving. So you haven't even opened your mouth yet to give that PreSession, but you have to take all of these into consideration as the medical interpreter. There are times where people may opt to bow for other cultures, particularly Asian cultures, and that is perfectly acceptable. But note that if you come from a Latin or a Caribbean culture where people are more physically affectionate insofar as their greetings, you cannot do this with the LEPs. It is considered breaking the rules, if you will. Even though that is fine and completely acceptable in our personal lives, we cannot do this while we're on the job because there are other implications at play. So the way you may greet an LEP during a PreSession has to be different from how you would greet them in your personal lives. So that's also a pitfall for many new interpreters or interpreters that have not been properly trained. So this is one of the small things that really makes a huge difference. We'd like to take a moment to thank our sponsors, the West Linguistic Training Group, LLC. The West Linguistic Training Group specializes in providing professionals with the tools necessary for success. They offer a variety of services of innovative training courses that promote corporate training, media and school translation services, interpreter education, and mediation services. They're located in Duluth, Georgia. We would also like to thank One Voice Medical Interpreters, located in Atlanta, Georgia, providing high-quality and dynamic language solutions to organizations in the medical field to help them achieve a fluid communication and a better connection with their patients. And now we've reached the segment of our show where we invite the audience to ask us questions. Today's question, our very first question, is from Cesar Estrepo, and his question reads, if I shake the provider's hand, do I also have to shake the LEP's hand? And that's a great question. Thank you, Cesar, for asking that. So my response to that is this. Whatever you do with regard to your communication, you'd have to do for one, whatever you do for one with regard to your communication, you'd have to do for the other. So logic would dictate that whatever you do with regard to anything physical, you'd have to mirror for one what you did for the other. So what that looks like is, if I shake the provider's hand, of course, to be polite and to not offend, I would have to shake the LEP's hand. So the best thing to do is to not shake hands at all. Now, how do you avoid this, particularly in American culture and society where shaking hands is an accepted and sought after greeting, an expected one? So what would I do? As an interpreter, one of the things we advise trained interpreters to do is to carry a notepad and a pen. This is not only so you can take appropriate notes, which we'll discuss later, but it's also serving as your border, your boundaries, if you will. This prevents you from having to use your hands because your hands are already full with your notepad and your pen. So if you have one in one hand and one in the other, you won't be expected to shake hands. So that's one way to get around that. However, what if that day the provider extends their hand to you? Now, we must never turn down an extended hand. That would also be highly offensive. So what we would do is you shake the provider's hand and then you shake the LEP's hand. However, keep in mind that sometimes physical touching of any sort between different genders is prohibited in many cultures. So you would have to be aware of which cultures you're serving. Now, does that mean that you will know every single culture out there? No, not at all. But a professional trained interpreter would have to know a majority of the population that you're serving. So physical touching might not be the best route for you to take. So in that case, what I would advise Cesar to do is to hold that notepad in your hand and hold the pen in your other hand and be warm. We are customer service oriented, so smile. Everybody responds to a smile well, and smiles are the traditional way to let people know that you are happy to see them. So there is nothing wrong with giving a smile to both people. That alone will really open them up to the experience of your PreSession, and that will open them up to building that rapport between each other. If you smile, they will smile. And if you smile at them, they will not only smile at you, they will smile at each other. You will see that it really is a contagious thing. So by all means, keep your notepads in your hands, keep your pens in your hands, but give a smile. That will go a really long way. So at this point, we invite you to continue the conversation with us. Send us more of your questions. We're excited to answer them. We're looking forward to continuing this discussion with you as we progress further. So thank you so much for tuning into our very first episode of Building Healthy Connections. We're looking forward to speaking with you again. Stay tuned for the next episode.
Thanks for listening to this episode. Stay connected through our website, www.buildhealthyconnections.com, or through our social media channels.